Who'd like to come first then?
Irene, Finn and her children visit their new dentist for the first time.
Lovely and strong, aren't they? Goodness. Have you all got good teeth like this then?
I'm afraid mine, I hope.
Like thousands of others across the country, they've been struggling to find NHS care. But now, Genesis Dental Care has come to their town.
It has become quite difficult. There's quite big companies coming into the area, either buying out NHS dentists or they are going private themselves. So that has become quite a problem in the area.
In the past 2 years, Genesis has opened 9 practices across the East Midlands, and more are planned in Yorkshire. All are based around offering PCTs NHS dental care services where there's been a shortage. And all mark a sea change in the way services are provided.
Okay, let's have a little look around and see. You've got lovely
Because
teeth,
Genesis is the first group to bring the social enterprise model pioneered with the University of Huddersfield to NHS dental care. Putting people before profit.
We're trying to encourage good, healthy living.
This is exactly what the area needed. Because people don't have to travel now so far.
Filling cavities in care.
The success for us is the number of people that previously didn't have dental services that have now got quality dental care.
And paving the way for a revolution in the way many areas of public health could be provided in the future.
There's no doubt that the social enterprise model could be rolled out to other areas of the health service.
This is the story of how Genesis came to be a revelation in healthcare.
Thank you very much.
Take care. See you again next time. Bye.
Alfreton, Derbyshire, home of Genesis, well known in the town as a church organisation that's building local services in a community hit by pit closures. Chief Executive Steve Holmes left a lucrative career in banking to set Genesis up.
Our first issue is how to do community regeneration and how to affect people's lives and how to do that in a sustainable way. So this project is really addressing the issues of Alfreton in Derbyshire.
And they've done it using the social enterprise model.
Social enterprise is about not-for-profit solutions to community problems. I mean, as an example, the big issue is a trading organisation, but it's a not-for-profit trading organisation. It helps homeless people by giving them the chance to sell the newspaper, and then any money that's made goes back into reinforcing the social mission of that business.
For Genesis, that means that in the past few years, they've opened services including a family entertainment complex, a small business incubation centre and youth training facilities. But Genesis is always looking to do more, and 3 years ago, it got the opportunity.
As a business incubation centre, there are always ideas coming through our centre. And funnily enough, dental walked in one day off the back of 2 dentists that were concerned of how to address the crisis, as it was 3 years ago in NHS Dentistry.
What often happens is there is a community need of some sort, and a social enterprise will pick up on that and try and find a solution to it.
The more that we assisted them with their business idea, the more that really we saw the synergy between social deprivation and oral deprivation.
We all know about the dental problems across the UK in different areas, and with Genesis they decided to do something about it.
Who's going to come in first then? Ellie? Are you? Please come and sit down, Ellie. Let's have a look at you.
And these new patients' appointments with their children are the result.
The dentist we were with in Alfreton had become private and that did incur quite a heavy cost. We were offered a dental plan, but that was over £30 a month for 2 adults.
It was very, very difficult to get an appointment with an NHS dentist.
I think it's fantastic that the money is going to go back into the surgery and that it's not a profit-making organisation, and hopefully it will make sure that there are more people going to get access in the area to NHS care.
This is exactly what the area needed.
Yes, I don't think there'll be a problem here. If when that baby tooth is gone and the new one's gone as far down as it can over the next 6 or 9 months.
We're now up to 9 practices throughout Derbyshire and Lincolnshire, expanding now into Sheffield, Barnsley, and we've just won a contract in Bradford and Ilkley. And I think there's no reason why we can't go towards 100 practices and on average 7,000–8,000 people. We're servicing 500,000, 750,000 people.
But it hasn't all been plain sailing. Not surprisingly, Steve and his team found PCTs at first reluctant to look at such an innovative business plan. But then Lincolnshire took the plunge.
In terms of a contract, we're wanting them to deliver a high quality service and the activity that we've set in the contract. And as far as we're concerned, Genesis are delivering on that. Patients are very happy with the service. And so we don't see the difference, and we treat them the same as anybody else.
Just relax your lip.
They're doing very well, actually. What we've seen of Genesis is that really in terms of their training and recruitment policies, they have worked with the Department of Health to international recruitment programmes, but also are looking very heavily in our area at training practice status as well, so that they can then bring in new blood to the area. And that's something we're really keen to work with them on.
So what is the difference? The University of Huddersfield's social enterprise lecturer Chris Lowe has been working alongside Genesis as it's developed its personal social enterprise models.
It provides an example of how an organisation, a voluntary organisation, can deliver high quality services that are much needed in the community.
First and foremost, the patient is getting good care. That's critical to us as a provider.
They've shown that you can identify community needs, you can do something about it.
We're doing smoking cessation programs.
They've brought creativity to try and solve a community problem that's been there for many years.
We link with counselling centres and debt counselling.
And they're really pushing forward. They've got a real social mission, and I think people need to acknowledge and recognise how important that is in delivering community services in areas of great need.
These are the issues. We've scoped our issues where people need these services, and we're trying to bring solutions.
Because of his age, this one has come into line, and I think when that baby tooth's gone, I think it will try to get into position there. Okay.
Which also helps the sorts of people that Genesis attracts to work for them.
When practices have not been around, or when the facilities have been very poor, people tend not to go. So consequently what happens is many cavities which were small become larger, and once patients start to arrive, then we realise that because the need is so great, it's not just a simple oil change that's required, but often it's a 20,000-mile service that we need to do.
Bob Russell was semi-retired, and then he found out about Genesis.
I was initially drawn to the fact that they were providing facilities in needy areas for dentistry, and as part of my own personal ethos, it just fulfilled that need at that time. One minor thing here, she's got a slight, at the front, they're just slightly crossed over here.
Yes.
And because profits go nowhere but back into the business, Genesis is now looking at even more innovation.
Rural service delivery, and to the people that are missing out on services at the moment, is a key point for us. So we're looking at mobile units, we're looking at innovative solutions with churches and community halls and things like that no other corporate will go there, right? But a social enterprise will choose to go there because people come first.
And ultimately, when the benefits are so clear, no one involved believes it should stop there.
Social enterprise can make a real difference over the next few years.
What a wonderful idea.
The key is to say that there is a solution that doesn't involve simply the public or private sectors.
The tremendous thing that gets you up each day is not just business, but it's actually the social advantage of social enterprises.
And this gives us a chance to drill down, if you like, into communities and to actually see communities driving their own solutions.
For the children in this area, it's tremendously important.
There's nothing to stop a social enterprise GP surgery, or as we're seeing increasingly in the south of England, social enterprise midwifery services and this kind of thing.
I think this is really something that people need to take a close look at, because it does in fact work.
So it's a model that can and should be more widespread.
There's a real heart side to our business, you know, and maybe not every commercial person might be attracted to that style of business, but the people that are generally people that want to make a difference.